the teaching point here is just to sort of realize that ganglion cysts can develop anywhere. So anywhere the two bones come together, you can get a ganglion cyst, and that's what this is through here. So again, treatment options vary. Studies actually show us that if we just drain it, 50% of these will recur. There's other treatment options available. We may have talked about those in the other videos in terms of using bracing. The studies for that aren't that great in terms of how efficacious it is. They used to use a hyaluronic acid derivative, or a hyaluronidase, sorry, more specifically, that would break down the hyaluronic acid, which is what the synovial fluid is made of. But again, because this communicates with the joint, theoretically it's not the best treatment. So what we'll do today is we're going to drain this. So we're going to just, we've anesthetized this with some xylocaine. So we're just going to see if we can rupture the actual ganglion cyst. So what we should get out is a gelatinous material, and then we're going to put steroid in. So studies actually show that as opposed to this 50% recurrence rate, if we instill the steroid, this will reduce down to about 15% recurrence rate. And even at the very worst case scenario, we should see that it comes back at a very lesser amount, so hopefully it's not bothering her to a certain extent. Now there's two different ways to do this. Oftentimes, depending on where it's at and how it's located, I'll get a very, very big syringe. We'll put some freezing in, and then we'll drain it out, and then we'll, without losing the needle, we'll then switch it out to put in some steroid component. If you do choose to do that, you have to use a very large bore syringe, like maybe a 50 cc or 100 cc, because you have to put a lot of back pressure because, again, you're sucking back a jelly that's really quite thick. All right, so you can't feel that at all?
No.
So again, I'm just going to use a number 11 blade and put some back pressure on this. And you can actually feel when you do this, you'll feel a little bit of a give. Usually when you're into the cyst, you'll see that gelatinous material is coming out. That. Rupture that as best we can. And just express it. Keep in mind now, before we started videotaping, you can see that's coming out there. This was pre-treated with chlorhexidine and alcohol. You okay there?
Mm-hmm.
And just keeping in mind, you know, if we can keep the surface somewhat clean, it's always a good idea. So you can appreciate the fact that that's collapsed down. And whether you get all of it out, it's not as critical, because again, there's always going to be some remaining there because it's continuous with the underlying joint. So then this is just a 25 gauge needle. And the advantage of the other method, when you have your needle right into it, then you know exactly you're into the cyst. But here again, the steroid is going to be around this area, so you certainly want to draw back, make sure you're not in the vessel. And some of this will come out, but some won't.